Did you know that starting January 1st, 2025, Medicare just made the biggest change to prescription drug costs in over 20 years? If you're one of the 4% of seniors who skip medications because of cost, or the additional 3% who cut pills in half to make them last longer, this video could save you thousands of dollars this year. If high prescription costs are stressing you out, hit that like button right now, because what you're about to learn could be the financial relief you've been waiting for. The problem: soaring costs and tough choices. Let's start with some eye-opening numbers that affect millions of American seniors right now. According to the CDC, 89% of adults over 65 take prescription medications. That's nearly 9 out of every 10 seniors. But here's the shocking part. Over half of seniors take 4 or more different prescription drugs every single day. And the costs? They're staggering. The average 65-year-old retiring today can expect to spend $172,500 on healthcare throughout retirement. That's up from $165,000 just last year. Healthcare costs for seniors average $11,300 annually, which is 2 to 3 times higher than what younger adults pay. But the most heartbreaking statistic is this: nearly 4 million seniors aged 65 and older have unpaid medical bills, despite 98% having health insurance. Think about that. Almost everyone has insurance, but they still can't afford their medical costs. The CDC found that approximately 4% of seniors can't afford their prescriptions at all. That means they're going without life-saving medications. Another 3% are playing a dangerous game. They're skipping doses, delaying refills, or cutting pills in half to make them last longer. One family medicine doctor shared a story about her diabetes patient who couldn't afford his monthly insulin. Despite being on both Medicaid and Medicare, the copay was too challenging for him month after month. So he rationed his insulin, a decision that could have killed him. The downstream effects are catastrophic. When seniors can't afford their medications, they end up in emergency rooms and hospitals, creating a massive burden on our entire healthcare system. The 2025 solution: a $2,000 cap. But here's where 2025 changes everything. The most significant Medicare reform in decades just took effect, and it's specifically designed to solve these exact problems. First, the big headline: Medicare Part D now has a $2,000 annual cap on out-of-pocket prescription drug costs. Let me repeat that. You will never pay more than $2,000 per year for covered prescription medications, no matter how expensive they are. To put this in perspective, before 2025, there was no limit at all on what you could spend. Seniors taking expensive cancer drugs or specialty medications could easily spend $10,000, $15,000, or even $20,000 per year on prescriptions alone. Here's how the new system works. You'll pay for prescriptions until you meet the $590 deductible. Then you'll pay 25% of drug costs until you reach $2,000 in out-of-pocket expenses. Once you hit that $2,000 cap, Medicare Part D pays 100% of your covered drug costs for the rest of the year. You pay absolutely nothing. This change alone is expected to help 3.2 million Medicare beneficiaries save money on their medications in 2025. Those who reach the cap will save an average of $1,500 this year, with some seeing savings of $3,000 or more. The donut hole is gone. Remember the confusing Medicare donut hole that left so many seniors struggling with unexpected high costs halfway through the year? It's completely gone. For years, seniors would start the year paying reasonable copays, then suddenly find themselves paying much higher costs when they hit the coverage gap. It was confusing, unpredictable, and financially devastating for many families. The elimination of the donut hole means your drug coverage is now straightforward and predictable. You'll never face that scary middle phase where costs suddenly skyrocket. Instead, you have consistent coverage that gets better as the year goes on, not worse. This simplified structure makes it much easier to budget for healthcare expenses throughout the year. No more surprise bills halfway through. No more rationing medications because you can't afford the coverage gap phase. The monthly payment plan. Medicare also introduced something called the Medicare Prescription Payment Plan, or M3P. This is huge for seniors who take expensive medications early in the year. Instead of paying hundreds or thousands of dollars up front when you fill a prescription, you can now spread those costs out over the entire year in monthly installments. There's no interest charged and no fees to participate. Here's how it works. If you sign up for M3P, you won't pay anything at the pharmacy. Instead, your Medicare plan will bill you monthly for both your premium and your drug costs. Your monthly payment depends on which drugs you take and when you sign up for the program. This means someone taking an expensive cancer drug that costs $2,000 upfront could instead pay about $167 per month, making their medication budget much more manageable. Now, let's move on to insulin and vaccine savings. Insulin costs are now capped at $35 per month for covered insulin products. That's a maximum of $105 for a 3-month supply. Plus, Medicare Part D patients can now access recommended vaccines, including flu shots, shingles vaccines, COVID-19 boosters, and RSV vaccines, completely free. These vaccines used to cost seniors hundreds of dollars out of pocket. Real-world savings. Let's look at what this means in real dollars for real people. The government estimates that about 11 million Medicare Part D enrollees will hit the $2,000 cap in 2025. These 11 million people are projected to save a combined $7.2 billion. That's about $600 per person on average. But for those who don't receive financial assistance for their prescription drugs, the savings are even bigger, an average of $1,100 per person in 2025. Consider this example. A senior taking a specialty medication that previously cost $800 per month would have paid $9,600 per year. Under the new system, they'll pay a maximum of $2,000, saving $7,600 annually. If these changes could help you or someone you love, show your support by hitting that like button. And drop a comment below. What's been your biggest challenge with prescription drug costs? What do you need to do now? So, what action do you need to take to benefit from these changes? The good news is that if you're already enrolled in Medicare Part D, these changes automatically apply to your coverage starting this year. However, this is more important than ever to compare Part D plans during open enrollment. Why? Because while the out-of-pocket maximum is now standardized, the drugs covered by each plan can vary significantly. A medication covered by your current plan might not be covered by the same plan next year, or it might cost less with a different plan. Make sure your plan covers all the medications you take. Check the plan's formulary. That's the list of covered drugs, and compare costs between different plans. Even small differences in monthly premiums or copays can add up over a full year. Also, talk to your doctor about generic alternatives if you're not already using them. Generic drugs can cost 80 to 90% less than brand name medications and count toward your $2,000 cap just the same. The future looks cheaper. These changes are just the beginning. The $2,000 cap will increase slightly each year. It'll be $2,100 in 2026. Medicare is also negotiating directly with pharmaceutical companies to lower the prices of the most expensive and commonly used prescription drugs. The first round of negotiations already resulted in price reductions of 38% to 79% for 10 of Medicare's most costly drugs. 15 additional drugs were just selected for the next round of negotiations. 5 more ways to save on prescriptions. Beyond these Medicare changes, here are 5 additional strategies to reduce your prescription costs even further. First, always ask your pharmacist about generic versions. They're FDA approved to be just as effective as brand name drugs, but cost a fraction of the price. Second, shop around at different pharmacies. The same medication can have different prices at different locations, even with the same insurance. Consider mail-order pharmacies, which often offer better prices for long-term medications. Third, look into prescription assistance programs offered by pharmaceutical companies. Many drug manufacturers offer programs that can significantly reduce costs for qualifying patients. Fourth, consider pharmacy loyalty programs and discount cards. Even with Medicare, these can sometimes offer additional savings on certain medications. Fifth, take advantage of Medicare's free annual wellness visits. These visits can help catch health issues early, potentially preventing the need for more expensive medications later. Final thoughts. The 2025 Medicare changes represent the most significant improvement to prescription drug coverage in decades. For the first time, there's a true safety net that ensures no senior will face unlimited prescription drug costs. If you found this information helpful, make sure to subscribe to our channel for more money-saving health tips for active seniors. We're here to help you navigate healthcare costs, stay healthy, and keep more money in your pocket. Remember, these changes are designed to help you afford the medications you need to stay healthy and active. Don't let cost be the reason you skip doses or delay refills. Your health is worth the investment, and now Medicare is making that investment more affordable than ever. What questions do you have about the new Medicare changes? Drop a comment below, and don't forget to like this video if it helped you understand how to save money on your prescriptions. Stay healthy, stay active, and we'll see you in the next video.